The views and opinions expressed on the Nurses Station are those of our hosts and guests,
not necessarily the views of Emory University,
the Nell Hodson Woodruff School of Nursing,
or Emory Healthcare. Enjoy the show.
Welcome back to the Nurses Station. This is season 2 of the chance to come together on a web platform, on a video platform, on whatever platform you use to hang out with real nurses doing real work, during a real pandemic, trying to really figure out what's going on. It is so great to see you all. We have taken a little break from season 1. We are so grateful to be back with season 2 of the Nurses Station here at Emory University School of Nursing. We are so psyched to have sponsorship this year for season 2. We are so psyched to have some new platforms. We've built some ways to bring in more Q&A, to have more conversations, to have more extraordinary guests, to keep figuring out and learning from you and with you all, what are we doing? Because we are doing, as nurses, so much to make this world a better place. And everything with a capital EVERTHING, did I spell that right? Everything has changed. And we are here riding those waves of change and rolling with you all as we learn about those changes. It's nice to be back. And it's so great to see the extraordinary, outstanding Dr. Lexi Dunn, the Queen, Dr. Roxana Chicas, Dr. Carolyn Clevenger here together. It's nice to see you all again. I miss y'all. How are you?
Missed you
too. I love the enthusiasm. It's just, I love it.
I just had some coffee and I snorted it up my nose.
I'm sure you did.
I think that is not the appropriate route. I think you've missed one of the 5 rights.
That's true. I did not miss the 5 rights, the right route. You're absolutely right. And that's why I think my brain is bleeding. Guys, let's circle back. Let's do another brief introduction because I know we've got some new listeners and new viewers who are like, what is all this energy about? So let's kind of go around the room. And if you all, tell me your name again. I know who you are, but let's tell the audience your name, briefly about what you do. And then let's start to talk about where we've been and where we're going. Lexi, I have to start with you because Lexi always goes first. Isn't that a hashtag, Lexi goes first? Something like that?
It is now.
Lexi is first, not goes first.
Is first. There it is. Is.
When you're the queen, that's just how it goes. So for all of you out there listening, I am Queen. I'm Dr. Lexi Dunn Amore. I have a name change from last season because I got married. Did y'all know that?
Congratulations. Facebook told me that. I was so happy, but I was upset you didn't invite me to the wedding.
Well, it was...
Man, I didn't want to say anything.
My husband immigrated. Well, he was immigrating, and then it was a peak pandemic, so we really didn't have too much of a wedding. Maybe like 25 people, so we had to keep it really, really small just for safety. So I am Dr. Love now, Dr. Amore. I'm very happy with my new name and my new life, and everything's been wonderful. So I'm an assistant professor at the school. I'm a nurse midwife. I do deliver babies from time to time at the Atlanta Birth Center. So if any of our listeners want to have a baby, just jump on over there and I'll take good care of you. So everything's been good with me.
Dr. Love, if you want to have a baby.
Right. Just love your partner and come on in and see me.
Love it. Dr. Love, so great to see you again. And I'm so happy for you.
You too.
Dr. Clevenger, nice to see you. Yeah. I see you up in the next corner quadrant of my screen. Tell us about yourself.
Yep. So Carolyn Clevenger, still a professor, but now a new title since last year, Associate Dean for Transformative Clinical Practice. I'm a geriatric nurse practitioner, technically gerontological, and this new shift in my responsibilities just kind of reflects how much more I've been spending time focused on my practice and also new practice opportunities for other folks in our School of Nursing. So I've taken my clinic, which is Integrated Memory Care Clinic, and we've been in a pre-launch phase since we wrapped up our last season to expand that model and start another new practice model that we'll test here at Emory, incubate it, and decide if that's something we want to change, grow, replicate somewhere else. And to that end, I actually just filed for an LLC to have our startup so that we can replicate that model outside of Emory to other health systems. That's pretty exciting. I kept the same husband, but I did get rid of a kid. So, my oldest graduated high school and we've taken her off to college. And so we are down one in our household, but it's there's a mixed bag. It's good and also horrible, but wonderful. It's mixed bag. Really excited to be back. Happy fall, y'all. Happy New Year.
Carolyn, congratulations. And I can't imagine what like the shifts are like in your house with, you've got a kid at school and kids going back to school, those sounds, all those changes. Before we move to Dr. Chicas, I do want to pause just for a minute to point something very important out. For our listeners that followed us last season, you remember that we played a game called the acronym game. And the acronym game came up. Carolyn, you okay? You look a little pale. During the acronym game, if someone says an acronym and doesn't designate what that acronym sounds like, they get a point or they lose a point. And at the end of the season, the person I think with the most points loses. It's kind of like golf rules because we've said too many acronyms. And Carolyn, I love you. I love working with you. You're one of my favorite colleagues. But you did say LLC, and you didn't point it out.
Wait a minute, but pause for a second. Wait. Tim,
you're pausing my pause?
We were playing that.
Yeah, she should.
I'm pausing your pause.
I have an objection.
We were playing that. Did we agree as hosts that we were playing that game? So technically, did she violate anything?
No, I've not seen the informed consent for that procedure. And also, I think LLC is not a healthcare-related acronym. So I'm going to contest that.
Well, to our audience members, as you may well know, or you will soon learn, that nursing is full of acronyms and we often confuse ourselves. So we're playing this game to make sure all of our listeners know what's up. Now, Lexi and Carolyn, you both have very valid points, and I want to acknowledge those points, and I'm going to push back against both. One, the team voted that I could be the host for this first episode of the season. And as host, I have our contract right here. This is our Nurses Station contract. It's here, and somewhere in writing it says the host gets to make the rules. So I would like to make the rule that we're playing the game. Now,
but if I'm a queen, doesn't a queen trump a host?
Ooh, that's in the card deck.
Okay, I'll leave it alone.
But maybe we'll leave that to the audience.
Leadership at its best. You think what? That's fine. I'll take my point. I'll take it. It's fine. I'm a big girl. I can handle it.
Tim's gonna lose. Carolyn, we already know
plus,
at this.
I'm not scared.
Plus the powers to be, the judge says it counts.
It's true. And I did lose last year, but I'm going to win this year. So thanks for playing the game with us, y'all. Dr. Roxana Chicas, I'm so sorry. Let's circle back to you. It's amazing to see you again. Tell us what's been going on and tell us a little bit about yourself.
Yes, thanks for pronouncing my name so nice. So I was a postdoc last season at the School of Medicine, and now I am a newly minted assistant professor at the School of Nursing.
Woohoo!
Yay! So pretty excited about that. And we finished our longitudinal study in Florida. So I spent a whole month of July in Florida doing data collection with agricultural workers. If you've noticed, heat has been in the news quite a bit. It's really, really hot. And so happy to be here. Tim, you forgot to mention that you are a new doggy dad.
Right.
I did.
You have a picture?
The pandemic has changed. I do. He's actually sleeping on my bed right now. I don't think I can move my camera in this episode because I just see my room so well. He's literally right next to me. I was adopted on St. Patrick's Day 2021 by a guy named Wally Lamb Chop. And Wally Lamb Chop is mixed breed. He's 70 pounds of pure love. He farts like a champ, better than I do. He stinks, and he's the sweetest. He is like, I've never had a big dog pet in my life, and he has helped me get through the pandemic. So Roxana, thanks for mentioning him. Pandemic has changed a lot of things. I've adopted a dog. I've had the opportunity to publish a book with some colleagues. We've co-written a book on self-care. And I have to tell you all, just as a quick check-in, I'm exhausted. I love to reconnect with you all and to be here. But our teams in the hospital here at Emory Healthcare, across the state of Georgia, throughout the country, we're really, really struggling. So we continue to run on fumes, but we continue to stay creative and we continue to stay inspired to see what we can do to make this place a better place.
Yeah.
You know what? Let's shift forward. We've done some introductions. We could talk for hours, and someday we're going to do this together, and we probably will talk for hours. I want to ask you all, with everything that you've seen since the beginning of this pandemic, from the time we started the Nurses Station to where we are now with the break in between, the future of nursing is both scary and exciting. It's scary, I think, because we don't know what's going to come next. One thing I would argue we've all learned from this pandemic is to expect the unexpected. The way that humans change and think, and the way that we interact, and the rules and the regulation, like all of this stuff. Who knew this would come? But also, so that's kind of frightening. But then also, nurses have stepped up and stepped in ways that are completely unimaginable and inspiring. And despite all the losses we've experienced as a profession, we've also experienced some huge wins. So there's frightening stuff, there's inspiring stuff, but I want to ask you all, what does the future of nursing look like to you in your fields, and where are we headed? Big question, but this is a big podcast, and you all have big, giant brains. I know you can nail this question. So I just want to put it out there. What's the future of nursing look like to you?
I think I have to think about the future because the current is tough. You know, the current picture is really tough. So many people leaving, not just leaving their job and transitioning to something different, but leaving the profession. So hard to see. And it's not like they're leaving, I think, most of the time because they've maybe always had a dream to go into real estate. There's nothing wrong with real estate, but if it's, you know, an escape, I hate that for them. So, but I'm like the optimist, right? So I'm like, okay, what's coming? What's going to come from this? It's like when a couple goes through a really tough period, right, and they come out stronger. Like, how do we do that? How do we pull together even closer and come out of this stronger than we were before? I think with limited numbers. So when people are leaving, I've been thinking a lot about how do we value nurses, and it comes down a lot of times. People are like, "Oh, let's talk about pay. Let's talk about how much we're paying nurses," and that's obviously a factor. But I think for a long time, we've hoped that we would emphasize what nurses can think and less about what nurses can do, right? So, how do we give limited numbers where we will have to look at new ways of taking care of patients, and you maximize the critical thinking, the assessment skills, the prioritization, all of the brains that nurses bring to their jobs. Not to say that they can't do hands-on things as well. Absolutely, there are some things, and many times we like to do those as well. But how do we value what they bring to work beyond tasks? And I'm hoping that's the part of our future.
Yeah, and what a way to, that's professionalism too. I think even before the pandemic, Carolyn, we have talked about how nursing is a profession, though it's often not seen as such. And I love that point about it's not the tasks, but it's what we do, how we think. And it's what I'm hearing is really continuing to elevate the profession too.
Mm-hmm.
Yeah, I guess when I think about it, within the context of the pandemic, it's something that we didn't expect. And it's been on this large scale, and we as a profession have had to get really creative and innovative. So when I think about the future of nursing, I think about the innovation and the use of non-traditional solutions. I think the pandemic is showing us we can't keep using the same process that we've used in the past. We have to really get innovative. One of the thoughts I had was really incorporate more of a team-based approach. I think what's kept me going during the pandemic is the support that I've gotten from colleagues and working within groups. And maybe it's that we have to shift the whole, what is nursing? Like when you go in a hospital, it's like this one-on-one, or one nurse has 6 patients.
Mm-hmm.
We really probably need to get more into the team-based approach because we're burned out, we're tired, we're exhausted. That means we can make more mistakes. Then we go home, we don't have any way to show up for our families, and then we're sick, our families are sick. So really looking at the concept of community within the nursing profession. So really getting creative about how we approach care, I think is going to be how we move forward. Just one of the ideas I had.
Yeah. Lexi, I love that. When a good friend of mine and colleague, she's a social worker in Charlottesville, Virginia. Her name's Ebony Bug, and she worked closely with our nurses and physicians and has done a lot of extraordinary work. And she talks about this idea of community care that I think you're kind of getting at, as opposed to self-care. We talk about self-care. How's the individual taking care of themselves? But you nail it, Lexi. I think it's moving towards community care and team care, because to both y'all's points, we just don't have the people like we used to. And so how do we, improvise and overcome?
Yeah, for me, the future of nursing, I think that the history of nursing is really grounded in social justice and community health advocacy. And I think that the pandemic has shown how important social determinants of health are and how we need to have health equity for all, because everyone is essential, from the farm worker all the way to the CEO. We are all essential, and social determinants of health are really important for the health of the community. Grading the social determinants of health, I think, are policies. And I like policy a lot, but I just think that right now nurses are in a really good position to really make structural changes and influencing policy. And I think it's so exciting that our own Carolyn Clevenger was appointed to the Georgia Board of Healthcare Workforce by Governor Kemp of Georgia. So isn't that great that we'll have a nurse who's going to hopefully advocate for structural changes for the health of, all Georgians?
Yeah, Roxana, I was really thinking about that too, that, when we talked about future of nursing like 10 years ago, it was about developing nurse leaders, having more doctorally prepared nurses, having nurses in positions on boards, right? Like this. And this Healthcare Workforce Board, this is the first nurse that they've had join the board, formerly known as the Physician Workforce Board. So it's expanded. There's also a physician assistant and a dentist. So, but I think about then how do we then advocate now? And to your point around social determinants and understanding how critical those are to health, and this focus on achieving health equity, right? So I'm hoping another thing that we may have learned during this really difficult pandemic period is the notion of, in the midst of misinformation or ignoring things that we know to be true, I'm hoping that we as a profession now have a better understanding of our power and influence to hold to things that we know to be true. We know that we are not in an equitable place. We've met other quality aims around safety and timeliness, being more efficient, patient-centered. We have not moved forward on equity, and that's really where we sit now. And so I'm hoping all of this leadership development we've done for the last decade, now we can actually then put that in place to have this more focus on equity, because we've not really moved the needle there.
Yeah, agree. I'm gonna put a different hat on. I have a collection of hats because I have no hair. The nearest hat I have, this is a mask, but I'm gonna put a different hat on, and I want to ask a question. The hat I'm wearing right now is, hey, I'm thinking about going to nursing school. The only exposure I've had to nurses are the amazing nurses that provided care to a family member when they were sick years ago, and I was inspired to become a nurse. Y'all are talking about structural change. Can you tell me how a nurse, like, what's something tangible that a nurse could do to make that structural change? Wearing the hat of maybe someone who's interested in nursing, and this whole concept is brand new. Can you help me understand that a little bit more? Because I love it. What does that look like in a more tangible way?
So I think one of the things people have also observed about nurses, especially if they've taken care of a family member or for them, is that there is a lot of contact time, and the conversation hopefully is a little different. So the idea is that nurses are doing an assessment. So that means more than looking at your blood pressure. That the assessment is of you as a person. What's your social network? Who is in your support system? What's the housing situation and how stable is that housing? And understanding that when you are coming into an office visit where I might see you, you're coming into the hospital and you have this condition and things, what is now what we would call uncontrolled or exacerbated, that there are multiple reasons that could be underlying why maybe you haven't been able to do all of those self-management things we expect people to do. And so as part of the team, that nurse is gathering that information from you in a judgment-free, open and transparent conversation sort of way, and then adding that contribution so that, if you don't have a good diagnosis, and that's part of the diagnosis, there's no good treatment plan. So, it really helps nurses can fully understand the problem before we come up with a solution. So if the issue is around accessing medication because you don't have transportation to get to the one pharmacy where it happens to be the best price, the solution is around home delivery of a medicine you can afford. It's not a change in the dose.
So it's really thinking big picture on so many levels. I mean, it sounds like it's thinking big picture, but then doing very specific things within your sort of wheelhouse to make those changes. Y'all, I think we could talk about this for hours, and I think it should be talked about for hours. And I think finally, back to your point, Dr. Chicas, we are seeing nurses bending the scale, turning the tide when it comes to building equity through research, through advocacy, through our work with mamas and babies, Dr. Amor, the life-saving work that you and your teams are doing every single day. But we have a lot of work to do, and we're running out of time. So we are going to move to our guest interview, something that we love to do at the Nurses Station. Every episode, almost every episode, we like to invite other voices from around the country to share their perspectives on nursing, on work, on well-being, on advocacy, on policy, on global health, on public health, on everything. So we'll continue to share those. But before we move to our guest interview, I want to ask one last question to the group. I'm thinking of the words, and I'm not going to get this quote right, forgive me, but Gandhi is cited to have once said, "Be the change in the world that you want to see." Be the change in the world that you want to see. And I think we can all agree, at least on this webcast, there's a lot of change that needs to happen to make this world a better place. My question for you all before we close, in 30 seconds or less, no pressure, tell me what change you are actively working on right now in your professional work that you hope will change the world. 30 seconds or less. Should I just call on names, or is someone going to jump in?
Just call it out.
I'll start. Okay, I'll start to give you guys a little more time to think about it. Being the change. I literally, before this recording, just did a grand rounds for a group of physicians and nurses who are exhausted in a hospital in Virginia, and I pulled out my rubber chicken. And I do a lot of talks with this rubber chicken, and I intentionally put out the rubber chicken because it made people laugh. It was a moment, we had a really heavy conversation, and then we laughed together over a story about this goofy, really kind of awkward rubber chicken, another hat I like to wear. The change in the world that I'm trying to make step by step is to bring moments of levity and laughter, because our teams totally need them. All right, that's my change. Who's next?
I'll go. A lot of things I'm trying to do, but underneath every research project, paper that I'm writing, mentorship, all the things that I do, the main thing that I'm trying to show the world, particularly in nursing, is to be authentic, to be your true authentic self, to be unapologetically you and unique, because I think the past has tried to lump us into groups and say you should act or behave a certain way, but I believe that true change comes from being your authentic self and telling the truth and breaking down power structures. I believe that we cannot move forward as a profession if we want to maintain the status quo. So when I'm doing things, I'm trying to present a new way, innovative way, collaborative thinking, not a top-down approach, and just being authentic. That's the main way I'm trying to show up in the world.
Awesome. Thanks, Dr. Amor. Dr. Chicas.
Well, as you have seen, it's been very hot everywhere. So the change I'm trying to bring to this world is to improve the working conditions of farm workers, outside workers, so that they're not dying in the fields while they're picking food for us. And another change is that I want nursing students to know that public health nursing is awesome, and we can make lots of structural changes in public health nursing. And hopefully, I inspire someone to become a public health nurse.
Thank you so much. Dr. Clevenger.
So I'm also focused on a particular population, and this is my clinical practice and the thing I think that I'm on this planet to do, which is to bring much better ways of providing ongoing support and care to people living with dementia, and this is the piece, and their care partners. So many times we, we focus on the patient, which is, of course, we should, but they come with another. They come with a system. And so all of these barriers from including information about their care partner, there's a federal act that's not actually even implemented in every state to just get the name, to actually ask them about their own stress, because they are the best intervention and support I have. They're the best drug on the market, including the one that was just approved for supporting that person. And to make sure that they're part of the whole experience, and that they're engaged as the patient. So treating them as a total unit, and making sure that they have the tools that they need to support my patient.
Thank you. It's such an honor to be able to share some time with you all. And I'm super excited to introduce our next interview. So stick with us. We're going to turn to the interview, and also stick with us for the rest of this season. You can find us at nursing.emory.edu/nurses station. nursing.emory.edu/nurses station. Also, in all the places you find podcasts, we're out there. Find us, send us your feedback, stay connected so we can all continue to work together to try to make this world a better place.
So today we have a very special guest. We have Nurse Allison Benjamin, who's also known as Nurse Alice. She is a cardiac clinical nurse specialist and a family nurse practitioner with over 20 years of experience primarily in critical care and emergency medicine. She's affectionately known as America's favorite nurse. So Nurse Alice has been featured on countless networks, national networks sharing health and education. She's also the CEO and founder of Nurses Approved. And she hosts 2 weekly digital shows, The Exam Room with Nurse Alice and Nurse News Now with Nurse Alice. That's a tongue twister. Nurse Alice, thank you so much for being here with us today.
Oh, I'm really excited. Thank you for having me. Good.
I want to jump right in. I'm very fascinated with your journey as a nurse leader and a trusted source of medical information. You're very active with nursing organizations. You've served as a consultant to many policymakers. You've worked with the NAACP and the National Urban League. I would like to know, do you consider yourself an advocate?
Absolutely. I think all nurses are advocates, actually. We do education, health awareness, promotion, and things like that. And so what I consider what I do at in the public, the same thing that I would do at a bedside with a patient, with a family, raising awareness to important health issues, health initiatives, health policies, because I pride myself by saying I like to talk to people before they become my patients. So that's why I really enjoy working with other organizations outside of the hospital, community partners, so we can really help everyone to live healthier lives and make the changes necessary so I don't have to see people in my emergency room or in my ICU.
Yes, I have seen that on your social media a lot, that you talk about having a healthy lifestyle, that you want to talk to people before they become your patients. And so you've really managed to use social media to convey that idea. So you're a social media influencer. You have, again, found a good way to do that using merging nursing knowledge and social media. How did you learn to use social media effectively to make that message about a healthy lifestyle and talking to people before becoming patients? And could you share some of your best practices on how nurses can use social media effectively to be advocates?
Sure. So I've come to learn that, as a health professional, we can create all the health fairs and events and expect for people to come to us, but we're not going to capture everyone. So where is everyone? How can I meet people where they are? And most of the times they're on their living rooms, they're on their devices, they're at home. And so that really allowed me to think of using social media as a medium to express important health topics and education, to the general public before they become my patients. So I started to use social media as an extension of patient education. Now, it's a slippery slope. So as an advanced practice nurse, I've also, I read a lot of research. I'm looking at evidence. I've done a lot of work speaking to national groups. And so there was a certain level of professionalism that I wanted to make sure that I can translate to social media while still being fun and meeting people where they are and incorporating health literacy. So I was able to find a happy medium between the two. And so, I like to use social media to raise awareness on different health topics. And it allows me to, cater the message to the individuals that I'm educating. So, for example, I've done a lot of, just recently, a lot of education around fibroid awareness, how it predominantly impacts Black women. So I've been able to use and tap into different social media groups on Facebook, Instagram, Twitter, and things like that to raise awareness amongst Black women about the incidence of fibroids. And so I always lead with the health information. And then I do wear my nursing hat because I want my profession to be proud. And I do so responsibly, making sure that I'm not going to say anything that's offensive or demeaning to the profession. And so, in addition to sharing the important health information, I think it's a twofold. I think I'm also raising awareness to what nurses can actually do, and the different outreach and things that nurses can do in the profession, not just at the bedside, but also in the community.
Right. I think that's very important that we do go out into the communities and do health education and make ourselves accessible to communities so that they have a trusted source of medical information, someone they can talk to. And I think that, so I'm Hispanic, we're both minorities. I think that's also great for our communities to see, someone that looks like them and they can talk to them, I think makes a major impact. You've done a lot of work, and looking at your work, you have remained very committed to the profession of nursing and its development of its workforce. You're a very responsible nurse, and it just caught my eye that you said that you try to be very responsible when you post anything on social media, and so. And I guess that's why so many people call on you for advice, for guidance. So what does it mean to you to be a responsible nurse?
Well, I wear many hats. So not only am I a nurse, but I'm a parent. And so when I post on social media, I want to make sure that, what I'm saying, for one, is factual. It's based on the evidence and science, because we know there's lots of misinformation on the social media. We've seen that a lot with the COVID pandemic. So I make sure that what I'm saying is evidence-based. And then I also make sure that I'm using health literacy and giving examples or leading with that are relatable to the general public. I think, although I'm a nurse, people like to say, oh, it's social media, it's my personal life. Yes, but nurses are the most trusted profession. And I don't think the public knows how to flip the switch on and off that, oh, she's a nurse now, but now she's just being regular old Alice. So I make sure that I represent the profession very well. And I just try to be well-spoken and kind, and lead with good intentions. And I think if people do that, you'll probably do just fine on social media. But again, we have to be very sensitive. Today's climate, there's lots of things that can be said that are misconstrued. So always think twice before you click that post or send button to make sure that what you're saying is factual and that it's genuine and that, it's not harmful to anyone.
Yes, I agree. It can be a slippery slope. I want to shift the subject a little bit to burnout. Burnout has been a big issue in nursing, and COVID-19 has made it perhaps worse. Many say that we are in the midst of a critical nursing shortage that is expected to continue. What are some of the changes that you think need to happen to decrease the rate of burnout in nurses? What should our healthcare systems be doing? What should we as a society be doing to protect our nurses?
Right. So that's a multifaceted question with a multifaceted answer, because we do have a nursing shortage. even before the pandemic, and people may not be aware of that, we have, a lot of baby boomers, a lot of people who are aging out of our, of our workforce. I think nearly 50% of our workforce is over 50 years old. And we don't have enough schools and educational resources to replenish the nursing workforce. I mean, every year, approximately 80,000 people get turned away from nursing schools because there just isn't room or clinical placements or things for them. So you take that and then you couple it with a world pandemic. And, I worked the front lines during COVID. It was very, very busy. A lack of resources, lack of staff, overwhelmed with patients. And we had a lot more patients accessing the healthcare system, not enough resources, not enough manpower. And so that was another layer to it. And then I think there was this discrepancy of compensation and support amongst different hospitals. I know it's nurses, we pride ourselves in just caring. We don't really always involve ourselves in the finances of healthcare, but I think it's something that we have to address this elephant in the room. It was very challenging for some of my colleagues to be very committed and working endless hours at a particular facility. And then a travel nurse would come in making almost twice what they're making and not have the level of commitment to the organization. So I think some of those things rubbed nurses the wrong way. And so there's a lot of things that are going on. And I think the first thing that healthcare organizations need to do is to secure a solid workforce is to evaluate the work conditions of the nurse. Because I think so many nurses were overworked and underappreciated. I think that goes a long way. Saying, the thank yous and being more appreciative versus just only talking when something wrong happens. So I think health organizations need to do that. And then we need to evaluate the pay scale. And then I also believe that nursing organizations really need to partner up with these nursing schools to figure out a solution for the long term about how we can create better work conditions and then also usher in more nurses to help alleviate some of the problems and the shortage that we're having at the bedside. Because also some of the shortage was we didn't have enough of the specialty trained nurses. So we have lots of nurses, but not everyone was trained in ICU and ER to manage ventilators. So, what are things that we can do to get ahead of that? And I'm hoping this pandemic is in the rearview mirror. But even if it's not, we need to be prepared for the next emergency and start tackling those things now so we don't burn out all of our nurses, because we have several nurses who are so overworked and overwhelmed that they've considered leaving the profession. And that's the last thing that I want them to do.
Yeah. What message do you have to nursing students? Because they hear this conversation about burnout. What would you say to nursing students? What advice do you have?
I think, so I don't want anyone to be discouraged from entering the profession. There is burnout in the profession, but that's if we don't do anything about it. That's if we go in blindly and don't address the problems that are out there. So one of the things we need to tackle the shortage in nursing, work conditions. So I would like to encourage those who are entering the profession. First, I want to welcome you and say thank you. We need you, more of you. And we need to be more nurturing of our future nurses so they don't get burnt out, and just be more supportive as a profession. I know there's this old saying that nurses eat their young. And although I like to say it doesn't exist as much, I know it still does exist. So we have to really embrace our new nurses and really work hard to changing the work conditions so that they'll have longevity in our profession. And listen, compassion fatigue is real. Moral injury is real. We know that because there's evidence on there. So because we know it exists, we know that there's evidence, and we know that there are interventions to combat that. So I want to invite my senior nurses and our new nurses to both join forces and tackle that as we continue working this profession together.
Yes, I think that's really important. And yes, we want to welcome all new nurses, all nursing students. And I think it's also very important to have these partnerships between nursing schools and healthcare systems so that there's like a pipeline for nursing students to go in, and hopefully that healthcare system has them in place to support them. So I want to thank you so much for being here with us, and thank you for the opportunity for allowing me to interview you. It's been an awesome interview, and we look forward to having you again on our show.
Thank you. It's been my pleasure. And so thanks so much for you and all the work that you guys do. You guys are sharing important message through your podcast, and I really appreciate you guys.
Yes. And we can follow you at Ask Nurse Alice on Facebook, Twitter, and Instagram.
Yes. Please visit, send me a message, DM me, tweet me. I'd be happy to engage in any conversation. And I also have a website, asknursealice.com.
That was cool. It's so nice when we can have interviewees and people share their voices and experiences. Using Zoom platforms and recording, we can talk to people around the country and around the world. So we're so grateful for those perspectives that we just shared. And the reality is, we're just 4 nurses. And nursing as a profession is the largest healthcare profession in the US, if not the world. So we love incorporating other voices, other perspectives, because the only way that we're going to get to a better place is if we listen to all those voices and perspectives. So, did y'all hear that? So, we got 2 cool features with second season. Second season, first one is we're going to have interviews like the one we just had. And 2, we got these call bells. And those of you that are practicing nurses have all experienced call bells in your own professional careers. And the reality of nursing is that we set our plan, we set our schedule, we try to plan out our workloads and our days, but call bells come in and we answer them and we respond. Because what makes nurses spectacular is that we stick to our plans, but when our plans changes, when we get a call from the clinic, when the call bell rings and we need to address it, we can pause what we're doing, address it, triage what needs to happen first, and then still give the highest quality of care. So second season, we're going to have call bells, and the call bells come from folks like you all reaching out to us with questions. We welcome questions on the video format. We welcome questions that you want to email or text to us. We will do our best to answer every question you send in. And when you send them, the call bell is going to ring, and we're going to stop what we're doing because we're nurses and we know how to juggle. And we'll do our best to answer the questions. So if you all are okay, we're going to shift to respond to these call bells that we just got. I think we've got 3 questions today. The first one comes from Emily, who's a first-year nursing student. Emily, thanks for kicking off our questions. Emily asks, what advice do you have for someone entering nursing school? What advice do you have for someone entering nursing school? Roxana, let's start with you.
Okay. So my advice is to really enjoy the journey of nursing school and not become so fixated on grades. Just really enjoy and observe the content. And something practical that I used to do when I was a nursing student was that before a test, I would do lots of questions with rationales because that would help me think. And as we know, in nursing school, they're teaching us how to think and prioritize. So, but enjoy it, have fun.
Right on, thanks. Any other thoughts? Lexi, what would you say?
So many thoughts came through my head with that question. 2 things, I'll make it quick. 1, know what your why is. Why did you enter nursing school? Write it down, come back to it, because I guarantee you'll probably want to quit at some point, and that is normal to feel like you want to quit. So come back to your why and read it. The second thing is to remember that becoming a nurse is not just about the medical. What you're going to be trained to do is to take care of families and not just their medical needs, but a lot of the issues that surround them, the social determinants that we often talk about. So just kind of keep that well-rounded view as you move through your program.
Carolyn, any thoughts to add?
Sure. I would say, and this is maybe if I were going to put on a hat, although I do have things covering my head, so I don't need the hat like Tim, but the hat of the clinical placements responsibility, I would say be open to new experiences. And that's true for your clinical experiences, but just in general, volunteer activities, things that happen in the classroom, discussions you thought maybe you weren't interested in having. Because you have maybe some preconceived notions, very narrow, like I only want to work with this population in this setting. And in fact, there's so much out there. This is such a vast profession and there are nurses all across the health continuum, wellness to end of life. So just stay open and take each experience take the best things from each experience.
Right on, thanks. The only thing that I would add to that, and that is in support of everything that you all just said, there is no place in nursing for the term, that's not my job. Staying open, like Carolyn mentioned, it is our job. A lot of nurses with the pandemic are saying, I didn't sign up for this. No one signed up for it, but it is our job as nurses to be there work with it, to roll with it, to deal with it, to support people? That's a really great question. Thanks, Emily, for kicking that off. I think our next question is actually a video question. So I'm gonna ask our producers to roll video, and we'll see what we hear.
This is Kelly Goskowitz. I'm a DNP student, and my question is there some sort of video or a script that we can use to help us when we need to debrief a traumatic event or a critical incident? Thank you.
Wow, that's a great one. Carolyn, can I send that one your way?
Absolutely. So when I hear critical event or sentinel event, I think about quality and safety. And in the quality and safety space, there are actually a number of tools. I always go to the gold standard, which is the Institute for Healthcare Improvement, or IHI. And so there are debrief tools. But what I would say before you get into the tool, which is going to give you the sort of checklist of what you want to do in terms of topic and the questions we want to address, before you get to that, much more important is setting the tone for the debrief. And so that means making sure people feel like they're in a safe space, that the culture is open, that you have a blame-free environment, that you have a general mental model of why we do this and how we go about it, being comfortable with silence while you're doing it, and making sure that the person facilitating is open-ended questions and really actually looking to explore. That, in fact, is so important. I don't even care, part two, what you use for the actual questions, really, because those can vary. You want to get into what happened, what did we learn, what are we taking away, what would we do different, of course. However you get to that. But first things first, set the stage.
Right on. Thank you. And I know the literature around that is constantly changing as we're constantly examining what does that mean to debrief and how do we do it? A lot of different approaches. Great. I think we have one last question that was written in. This comes from Eric. And Eric writes, nurses are working really hard during this pandemic. Stress and burnout has been a problem for a while, but do you think COVID will lead to better situations for nurses? Y'all, if you're okay, I'd like to try to take a stab at that one, but if anyone has anything else to add. Eric, such a great question. You know, we have research now that has looked at burnout rates since the pandemic, and we have found in some studies that there's a significant increase in burnout rates, specifically among nurses, specifically among female nurses, as compared to male nurses, as also compared to physicians. We know burnout's on the rise. We don't need a study to show us that, but it's real, it's legit. Do I think it's going to lead to better situations for nurses? I don't want to sound overly optimistic, but I want to say yes. The nursing voice that we've seen across the country, the ability for nurses to organize and work together to support change on their units, in their hospitals. When I think of things like professional governance and different levels of organizations to bring the nurses' voice forward, where that is working in hospitals across the country, nurses are getting what they ask for: better pay, better PPE. Okay, Eric, let's be real. We know nationally there is a shortage of nurses. So we can have all the money in the world, all the PPE in the world, but we actually don't have the humans to do the work in many situations. Lexi mentioned this earlier in the program. One thing that she's really interested in is team-based care. So one way that nurses are getting what they need and growing from this are in hospitals and health systems where nurses are really engaging in that team-based care. Eric, is it perfect? Absolutely not. Do we have a long way to go? Yes, but I do see growth. I do see change. And it's our role to keep empowering the voices of our nurses as individuals, collectively, so that we can continue to change systems. We got a long way to go, but I think we can get there. I believe that we can get there. Anybody else have any comments to add on that last question from Eric?
Yeah, I want to chime in. I like Eric's question, and I think that you hit the nail on the head, Tim. I mean, I think we're in the spotlight still. Our profession is right out there, and the public is getting to see just how stressed and burned out we are, but yet we persevere, right? And so hopefully that will result in some changes for nurses, for our profession, increases in pay, additional resources. Maybe more people will be motivated to go back to school. We're going to need more professors. I think hopefully people will see the potential growth in the profession. But I also want us to remember that nursing is an international profession. And so there are some nurses in other countries that are suffering even greater than we are. I know I have family in Jamaica, and there was a story released just earlier this week that talked about the fact that about 300 nurses didn't show up for work on one particular day while they were in a lockdown. So you can imagine in a country that already has less resources, when your nursing profession, which is your largest workforce, starts to pull back, you're really going to start to see worse outcomes, right? So we as a profession really have to start talking about this burnout and come up with some realistic solutions. But I'm like Tim, I'm optimistic that we can do it. We always persevere, we always press through, and the future is still bright. So we just gotta hang in there.
Yeah, absolutely. Alexi, I think about a quotation I learned a while ago from Martin Luther King, who said, he reminds us we're all a part of this inescapable network of mutuality. This inescapable network of mutuality. And when I think about that and what you just say with nurses in other countries and workforce, just because we don't see it in front of us doesn't mean it's not affecting us on so many levels. And I think, as we stay creative and innovative about how we support each other, we need to think globally. And we need to recognize that both our good intentions and our good work can hopefully help spread out to help other people, but also what other people are doing around the world. How can we keep our ears open and our eyes open and our hearts open to learn from what's going on outside of our own country's walls so that we can learn together to get through it. I love this show, y'all. I love this opportunity to connect, to listen, to learn, to be challenged, to share and learn perspectives. And that's why we need you as our audience. We need you to reach out to us. Find us at nursing.emory.edu/nursesstation. Find us on all the places that you listen to podcasts. Check us out. Let us know your thoughts. Send us your questions via video, via text. Send us your concerns. We want this to be a place where new ideas can be shared, old ideas can be brought forward, and we can also have a good time doing it. We've got an upcoming episode that I'm really excited about. We're going to talk about vaccines. We're going to talk about why folks are getting it, why folks are not getting it. We're going to share some nursing perspective. It'll be a tough conversation. I think it's going to be a really important conversation, because if we don't talk about it, nothing's going to change. And I think we all can agree we got some changes that need to happen as we continue to move forward into this through this pandemic. So I'm really looking forward to that. If you have an idea out there in the audience, a topic you want us to talk about, send it to us. We'll work it in. And send us your thoughts about vaccines. Send us your thoughts about masking. Send us your thoughts about where you see yourself and your family and your community in this pandemic. We want to elevate your voice and hear your points of view. Whew. It's so nice to start this off with you all again, season 2. I look forward to our future guests, look forward to the future questions, look forward to more rubber chickens. This one squeaks. Y'all, thank you so much. Everybody out there, stay safe. Take care of yourselves. Take care of your families. Keep those masks on. Do what we know is right to help prevent and slow the spread of this horrible pandemic. We're with y'all and look forward to seeing you again. Bye, everybody.